Going back to your patients, Professor, with the melanoma, there's this perturbation in the immune system. Now, have you seen aggressive? Is the melanoma become more aggressive, a sort of more virulent melanoma as a result of the perturbations, which may well include the vaccine?
Completely. In fact, it's my colleagues who came up with saying, we're seeing this too. It's absolutely explosive. They coined this word explosive. And my colorectal colleagues are seeing this now. They're talking about explosive presentations of colorectal cancer in young people, particularly like they've never seen before. And it was one of those that the integration of the spike protein in their tumours.
So it's almost like a new disease, explosive colorectal cancer of the young.
Yeah.
That's
I mean,
terrifying.
why is it explosive? So they are presenting, and it's already in the liver and the lymph nodes of the lungs, whereas normally...
It's already metastasized.
Yeah, this is a process that when you put them under pressure, it gradually escapes. This is a slow process in most people. Explosive is extremely unusual, and the colorectal surgeons are all reporting this.
Now, have you seen any cases that you probably wouldn't expect of lymphoma, cancer of the lymphatic system?
Oh, absolutely not. I mean, I don't do lymphomas as in the clinic, so that's the first thing. But I'm hearing people who've, after their booster vaccines, have gone down with lumps in the neck and things like that. And I found a colleague worked somewhere else completely, and I bumped into them and I said, how are you? And I said, oh, I'm okay, but I've developed some lumps in my neck and they've been diagnosed as lymphoma. And I just, trying to be sympathetic, said, God, what earth caused that? And the patient said, oh, apparently it's due to the vaccine. That's what my oncologist said. And I said, but this is the reaction I'm getting everywhere. And yet, when we report it higher up the chain, we're told it's anecdote to shut up and not cause panic amongst the patient. At any rate, that person told me that 3 of her friends out of a couple of dozen had all had the same thing. It was quite amazing. Then I found somebody else locally had had a lymphoma diagnosed. Then I found a close member of the family had developed a leukemia, and that was after the booster vaccine. Now here, I want to point out that quite a few people, especially my age and etc. around, probably have low-grade B-cell disease, lymphomas, leukemias, etc.
Myelomas, and
Yes, and it's maintained under control because of the good, healthy T-cell surveillance. It keeps it under control. So when you give a booster and you start to find these B-cell leukemias and things coming more common, you don't have to look hard to work out what the pathogenesis is, why they've suddenly appeared. But my other colleagues are pointing out that they're seeing more renal cancer too, a lot more renal cancer. Now, renal cancer and myeloma were always lumped together as being tumours that seem to respond to immune therapy. They were both the ones that responded to interferon and interleukin-2 before we had specific therapy. So that again would fit the T-cell perturbation control theory.
And are we talking